Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm starting a new series on strokes. I've spoken about stroke in the past, but it's been for a long while. Stroke is such a common medical problem. In this segment, I want to speak more about the statistics worldwide and in the United States, different ethnic groups, men versus women, etc. And I'll get into a little of the basic as to why stroke occur and the different types of strokes. And over the next several weeks, I'll be telling you everything that you ever wanted to know about strokes and how to go about treating it, evaluating it, treating it, and preventing it, etc. Uh, uh, Worldwide, some 15 million people have a stroke every year, and 12.7 million of them have the stroke because of hypertension. In this country, 795,000 people suffer a stroke or a new stroke every year. 600,000 of those strokes are new strokes, and 185,000 of them are recurrent stroke. Every 35 seconds, someone suffers a stroke in the U.S., and every 3.3 minutes, somebody dies of a stroke in the United States. And every year, you have some 7 million folks in this country that have a stroke. And 143,579 people die of a stroke every year. It is a serious problem. And worldwide, 5 million people die of strokes every year. And stroke causes 5 million people to become permanently disabled. And stroke is the second leading cause of death across the world. Serious problem. And of course, talking about the rate of stroke in terms of different minorities, it is clear that stroke is higher among ethnic minorities than it is among white folks in this country, and for that matter, probably across the world. Let me give you an example. The rates of stroke in ages ranging 45 to 84 are 6.6 per 100,000 in black males, 3.6 per 100,000 in white males. And the black female in the same range of age, 4.9 per 100,000 as compared to 2.2 in white females. So this is serious disparity here. And if you're looking at the country, the so-called stroke belt that I call it in this country, which consists of Alabama, Arkansas, Georgia, Indiana, Kentucky, Louisiana, Mississippi, North Carolina, South Carolina, Tennessee, and Virginia. This is the so-called stroke belt, the 10 states that have the most strokes in the United States. And it is not, you don't have to sort of go too far to fetch the reason, really, because it's the South. I just finished telling you that stroke is many more times higher in minorities than it is in white folks. And in these states, of course, they have the highest rate of racial discriminations. And these people live there, but they're under constant stress from racial disparities every single day. And it is not hard to figure out why they're developing so much strokes and dying so much more frequently than other folks. So you wonder, well, what is this stroke business? Well, the vast majority of strokes is the result of hypertension. And of course, in this country, they just redefine, for whatever it's worth, what hypertension is, and I don't buy it because, frankly, the really hardcore number is some 76 million people really suffer from real hypertension. The others that they added on, people with blood pressure a little bit over 189, they call that hypertension, a little bit here, a little bit there. This is just for literary publicity and to sort of to dress the subject, to make it look cuter and nicer looking, but it has nothing to do. For instance, you wouldn't, an elderly person, blood pressure is, 140 over 90. You have to be very careful not to lower that too low because they're older. They need that extra little push in the pressure to perfuse the brain. So if you listen to this recommendation these people are telling you and you start treating these people, you're going to cause stroke because you're going to drop their blood pressure too low and they're going to have inability to perfuse the brain and they can drop of a stroke right there. So you got to be you have to take this thing with a grain of salt, okay? So let's take, for instance, first of all, there are different types of strokes. You have ischemic stroke, you have hemorrhagic stroke, you have stroke that's the result of a thrombus that shoots something to the brain. That's a thrombotic stroke, etc. Then you have aneurysm that different people have, they don't know anything about it. And out of the blue, for one reason or another, the aneurysm will rupture, cause a massive bleeding inside the brain. They have a stroke that way. The most common stroke is ischemic stroke. So let's talk about how do you go about the ischemia. Ischemia means that there's narrowing inside the vessels in the brain or in the carotid artery that's preventing blood and oxygen to get to the part of the brain where it is needed. And the lack of the oxygen, the lack of blood flow, therefore the lack of oxygen, resulting in ischemia. That's what ischemia is. And so the ischemic stroke is the most common. Let's take a moment to go over the basics. How do you go about from hypertension and ischemic stroke? Of course, hypertension can cause the vessel to rupture if the pressure is excessively high and could have bleeding stroke that way. But let's take it one step at a time. Here it is. The pressure inside the blood vessel is supposed to be normal. If it is not normal, the fact that the pressure is elevated inside the vessel, no matter the size of the vessel and the arterial system, which is what I'm talking about, what you have there, you have the first lining of the blood vessel is called the intima. Now this is basic physiology that I want you to take time, take a breath, get a soft drink or a cup of tea and relax so that you could fully understand it. The very fact that the pressure is elevated inside the blood, inside the vessels, that's abnormal. That abnormality then, because the intima was not created to be able to withstand elevated pressure. And the first lining is called the intima. The fact that the pressure is high inside the vessel causes an aberration to occur in the lining of the intima. That's it. Now, once that aberration develops, as the blood is passing through the vessel, carrying all sorts of debris, so it can get to be processed to the liver and then get shifted to the kidney for the kidney to excrete those debris. That's how it works. All of us inhale a bunch of junk unknown to us, to the environment, etc. That stuff, the body must get rid of it. And it has to get into the bloodstream. Once it's getting into the bloodstream, then it has to be passed through that and then get urinated out, if you can, depending on the size of it. So that aberration then eliminates the smoothness of the first lining. And once that occurs, then you have a nidus. The first thing that occurs is a nidus, we call that. And right there, where the nidus occurs, the blood traps stuff that's passing through because it's no longer smooth and it can trap stuff. And what it traps stays there. Rather than going through, it stays there. That then begins the formation of plaques. Because once the nidus gets there, you first develop a local inflammation. That's right, because it doesn't belong there. It's a foreign substance. So the body reacts against it. And you have a local inflammatory reaction that's taking place, and then one other debris pile up on top of another debris, and you begin the plaque formation process. That's how, my friend, that you develop narrowing of the vessel due to the plaques that are being developed as a result of the elevated pressure throughout the arterial system, no matter the caliber of the vessels. That's what happened. And of course, then you have platelets. It's passing through as wet, so the platelet gets stuck there. And once the platelet gets stuck there, that makes the situation worse. So oxygen cannot go through properly, and the area of the brain that these vessels are responsible for, that area of the brain is being starved of oxygen because blood cannot get there properly. That's the process that allows hypertension to be the precursor, the thing that's actually causes the most stroke throughout the world. 12.5 million of the 15 million stroke that occur in the world are the result of hypertension. So therefore, then, hypertension is the number one cause of stroke in this country and throughout the world. And 1 out of every 3 adults in the U.S. population suffers from hypertension. And 1 out of every 2 black adults suffer from hypertension. So therefore, then, hypertension is the number one disease in this country and throughout the world. As a result of that, hypertension is the number 2 leading cause of death in the world. Serious problem. And I have done shows on hypertension before, and I'm not going to bore you to try to explain to you why, but I'll give you a little detail since I'm talking about hypertension, and it is the culprit that causes the most common blood pressure stroke in the world. What is hypertension? Where did it come from? Take a minute. Many years ago, before my hair were gray, I was just young graduated physician, finished with my training, full of knowledge, trying to make a name for myself, starting to write book. In fact, this is my, I guess, 26 years doing this show next month, November, when I wrote my first book, Status of Health of Blacks in the United States of America, A Prescription for Improvement. That was my first book. From the top of my head, I didn't know anything about writing. I've never took a writing course. I've never even taken a composition course in college. I was busy doing my biochemistry and my biology stuff. That was my concentration mostly. So I came up with ideas all over the place, tons of ideas. One of the ideas that I came up with was, how did the people who began this world, namely the original native Africans, because all of us, to one degree or another, no matter what we look like, we are African to some degree. You can't be a human being and don't have African gene in you, no matter the color of your skin. All you have to do, let me have access of your DNA, and I can prove to you where you came from. That has been clearly documented by the powers to be in the genetic world. So I sort of came up with the notion, how did these people survive in the incredible hot temperature that existed in Africa? And also, how did the few Negroes who survived the passage through the slave carrying boats survived with all this lack of food, lack of water. I came up with the idea that, I tell you, there had to be a gene in the body somewhere that allows them to hold on to salt, because the salt is the key. Right now in the New World, too much salt is a disease that can causes hypertension. But back in the ancient Africa, it wasn't a disease. It was a life-saving gene that allowed people to hold onto salt, hold onto water, so as not to collapse and die. Many of them did, but some survived. I came up with that idea from the top of my head. And sure enough, I published that notion out of nowhere. And a few people who are smarter than me and have more money than I do decided to take a look at this. And they did. They did. Georgetown University, University of Virginia, and I think to some degree Emory University may be involved. They actually had access to kidney specimens from Japanese American, Caucasian American, and Black American from Ghana. You can't make this up. They actually had kidney specimens from each one of these three ethnic groups. And they decided to grind these individual kidneys separately to sort out the DNA. You can't make this up. And they did. And sure enough, my friend, they discovered the gene, which is G protein coupled receptor kinase type 4. G protein coupled receptor kinase type 4. It turns out that all human beings, as it turns out, have that gene in our kidneys. I didn't know what the heck I was talking about. It was just ideas, because I'm an idea person. And this was published, and they did the research. It took them many years to get this done. And when they did it, I think it was published in 2002, and the U.S. Academy of Sciences or something, someplace like that, which I think they just changed the name recently. And the rest is history. Now we know the basis for 97% of all hypertension is because of this gene that is located in the kidney of all of us, that allow us to hold on to salt and hold on to water, expand the intravascular system, the pressure goes up. But except that it is a disease in this part of the world, and most of us, but back then it was a life-saving gene. How about that? And because of that, the entire ways that physicians in this country or in the world now treat hypertension have been changed. Many, many medications that give blood pressure, to treat blood pressure, have now been attached a diuretic, a water pill to them. Plus, we use the water pill by itself. As a result of that, you cannot have a normal functioning kidney and get your blood pressure treated properly without a thiazide diuretic. How about that? So the GC7, which is, believe it or not, the only disease in this country that is really supervised by a committee, is hypertension. And the seventh report, we call it JNC7, that's when it become the standard now, they publish that you have to add a thiazide water pill and everyone who have functioning kidneys who have hypertension. If you don't, you're not treating the blood pressure properly, no matter what you think. Even if you were to lower somebody's blood pressure temporarily by giving them massive doses of other medication that can drop the blood pressure quickly, it's going to rebound. Because as soon as the kidney senses that the pressure is being dropped, we go right back to Africa, the African notion, the kidney is going to hold onto aldosterone, which is the salt that's in the kidney, so as to hold onto water, so as to keep the body alive. In fact, it doesn't matter why the pressure drops. The pressure could drop because you're in shock because of a heart attack. The pressure could drop because you've been stabbed or you're in an injury or whatever, you're bleeding. Doesn't matter. You become hypotensive. Every single human person who becomes hypotensive, automatically the kidney holds onto aldosterone without knowing the cause. The cause doesn't matter. Hold on to aldosterone so as to hold on to water, so to keep the body alive. That's one of the jobs. The kidney is not just there to get rid of waste product. There are many, many substances that are produced in the kidney. That's exactly correct. One of them is aldosterone, which is the very last step in the renin-angiotensin-aldosterone system. If you don't block that, you're not treating blood pressure effectively. Even if you were to bring somebody's pressure down, eventually it's going to catch up with you. So you understand that? And since then, at Yale, they repeated the same study in mice, in rats or whatever, all been proven. How about that? So this is now, therefore, the basis for essential hypertension. 97% of all hypertension is due to essential hypertension. And the cause for essential hypertension is due to that gene that's located in our kidney that all of us inherited from Africa. Every day, we got stuff that we're dealing with, like it or not, is because that gene came from Mother Africa, and now we're dealing with it in the modern world. We don't talk about it because we have all this racial craziness going on. This person is better than what person, because of the hogwash. The fact is, all of us, every single, you're not a human being if you don't have African gene in you. Immediate African gene. The color is a different thing. The whole color business started as an atmospheric issue. That's what it was. Everybody, when they left Africa, they were black skin. And I'm not bad-mouthing. This is the science. The actual scientific fact. All of us. And then because of where we live, then the skin pigmentation began to change. And because genetic is such a powerful thing, if you're light skin, your skin is light, you're going to give birth to somebody whose skin is light as well. That's all it is, an adoptive phenomena. But nobody originally were born white. That's the facts. That's the scientific fact. You could check it if you want to. So therefore then, that's one of the bases of things that can cause somebody to have stroke so often. How do you go about having high cholesterol and get a predisposition to stroke as well? How about that? Let's take a look at that. Now that I've told you everything about high blood pressure. Well, if you have a high cholesterol, hyperlipidemia, the different subgroup of it, the whole idea what's going to get you is that you're going to deposit some of that cholesterol material into your vessel. The high flow system, also known as the arterial system. That's it. That's the danger of high cholesterol. Doesn't matter where the vessels are. As long as they're from the arterial family and you have high cholesterol, hyperlipidemia / whatever you want to call it, because you could be high triglyceride, blah, 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 or a combination of both, eventually you're going to wind up with narrowing of those vessels because plaques get deposited in them, and then that then causes the caliber of the vessel to become narrower and narrower and narrower, and then blood therefore then cannot go through, so therefore the vessel cannot deliver oxygen where it's supposed to everywhere in the body, including the brain. So that's how you wind up with hyperlipidemia as a predisposing factor for developing stroke. Now, I'm not going to sit here and go over the details of how hyperlipidemia does that in many other ways. If you want to come to my office next Monday, I start teaching. I can explain that in front of the student and you benefit from that. Of course, I know I'm just making a joke, but yes, I do start teaching next week. So how do you go about diabetes has a predisposition to causing people to have stroke. How do you go from there? Well, let me explain. When you have diabetes, there are many different ways that the diabetes can cause you to damage your vessel. Because you have to understand something. Once the glucose is elevated, there are several other sugars in the body that also become elevated. We don't measure them clinically, but they also become elevated. Well, the nastiest one is sorbitol. How about that? Okay, so, and so doing then, that can itself lead to the damaging of the wall, the intima of the vessel, as I just mentioned to you. And or there are other mechanisms that I wouldn't dare sit here to bore you with that causes things to occur. That can cause, you can't make this up. Insulin is what we use to treat the sugar when it is elevated. How about that? But there are situations where because the person is obese, become the obesity, the person becomes insulin resistant. How about that? Once you're insulin resistant, by definition, you have too much insulin hanging around in your circulation. Once you know, the high level of insulin that's sitting in your circulation that cannot penetrate the fat cell because you have too many fat cells, that itself, you can't make this up, that itself can cause arteriogenicity to develop. How about that? I mean, I can detail for you all the different mechanisms to impress you, and I'm not going to do that. Who have ever heard of such a thing? That insulin that you need to actually use the sugar that we need to survive, if too much of it is hanging around, which is exactly what happens when an individual is obese. Not only he or she is obese, she can't use the sugar, so therefore she becomes diabetic, and or because the insulin is hanging around too long, the insulin itself can cause arteriogenicity to develop. And I can go on and lay all that stuff out for you. This is crazy. This is why we have a medication called metformin. That's why we use metformin. Metformin is used specifically to push that insulin in the circulation into the cells. It has nothing to do with the pancreas. Metformin does not stimulate the pancreas to produce insulin. It just forces the body to use the insulin that's in the circulation. How about that? Listen, I'm going to stop here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.